All right, so now we're going to talk about anatomical terminology. I've been teaching this for a long time, and I've heard many students say over the years that learning anatomy is like learning a new language. And that's very true. A lot of the terms that we use have roots in Latin and Greek languages. So a lot of that still carries over today. Healthcare professionals and scientists use a common language of special terms when we're referring to body structures and their functions. There are very precise definitions of meanings, and that allows us to communicate very clearly and precisely. For example, if I were to say the wrist is above the fingers, well, what exactly does that mean? I guess it would depend on whether I was holding my arm down beside my body or if I was holding my arm above my head. The wrist might not be above the fingers in both of those positions, right? So to prevent this kind of confusion, anatomists use a standard anatomical position and a specialized vocabulary when relating body parts to another, and also just for naming different areas of the body and how to refer to those. So we're going to look at 5 different categories of terminology. In my class, you're going to hear me often say, think about what the word means. A lot of times in the study of the human body, you're going to come across some pretty intimidating looking terminology. Great big long words that when you first look at them, you may have no idea what they mean. But as we continue to learn things about the human body, you'll see a lot of these terms, a lot of the prefixes and suffixes are used over and over again, and they can help you to break down big words and big terms and figure out some of what it's talking about, even if you can't get it all. So I hope to be able to help you to understand how to use anatomical terminology. So let's begin. All right, so we begin with the anatomical position, which is a standardized position that allows anyone that is observing or imaging the body to have a very precise and consistent anatomical reference. So correct anatomical position has a person standing erect, facing the observer. Arms are down at the side, palms are facing forward, and feet flat on the floor. Now, by using that correct anatomical position, any way that you describe one part of the body should always be very clear to anyone else that understands what correct anatomical position means. So here you see this body is in correct anatomical position. So she is facing the observer, arms at the side, palms facing forward. Okay, so we'll begin with our subject in correct anatomical position and look at some of the regional names. Regions are different areas of the body that are used to reference a lot of clinical application. For instance, if you had a cervical vertebrae that was dislocated or a bulging disc in your cervical vertebrae, okay, your physician, your nurse, and anyone taking anatomy and physiology would know that cervical refers to the neck. Cephalic always refers to the head. So cephalic is the head, which can be further divided into cranial, which refers to the skull, and facial, which refers to the face. Now you're going to learn a lot of these terms in lab, but we'll go briefly over them now so you'll be a little better prepared for it. When we're looking at the cephalic region, we can also refer to very specific areas, such as the frontal area, which is the forehead, pardon me, the temporal area, which is on the side of the head, orbital or ocular refers to eye, otic refers to the ear, buccal refers to the cheek. I bet you could figure out nasal. Yeah, nasal refers to the nose and oral refers to the mouth. Mental has nothing to do with the brain. It refers to the chin. All right, so moving on down the body, the sternal area is the breastbone. The mammary area, the breast. Umbilical is the navel. Abdominal, the abdominal area. Okay, so this right here, this is not your stomach. This is your abdomen. The stomach is an organ that's located within the abdomen. Coxal refers to the coxal bones, which are the hip bones. Inguinal refers to the area here where the legs meet the pelvis. The pollex is the thumb, manual is the hand, pubis is the pubic area. Dorsum is the top of the foot. The hallux is the big toe. Digital or phalangeal refers to the toes, and pedal is the foot. Tarsal is the ankle, crural is the leg, femoral is the thigh, patellar is the knee. Digital again refers to the fingers. Palmar refers to the palm of the hand. Carpal is the wrist. Antebrachial is the forearm. Antecubital, the front of the elbow. Brachial, the upper arm, and axillary in the armpit. Now, you may be wondering, why do I need to know all this? Well, if I told you that a patient had axillary lymph nodes removed, you would need to know what area of the patient to examine. If there was a thoracic lesion, you would need to know to look at the chest and not the bottom of the foot. So these terms are going to be used throughout your healthcare education. And of course, even if you decided not to go into healthcare, you're still always going to have a human body, right? Doesn't hurt to know a little bit about it. All right, so a quick look at the posterior surface. This was anterior surface with the model facing us. Posterior refers to the back. So we still have cephalic, the head, and cervical, the neck. The occipital region is the base of the skull. Scapular is the shoulder blade. Vertebral refers to the spinal column. Dorsal always refers to the back. Olecranon or cubital is the back of the elbow. Lumbar is the lower back. Sacral is the area between the hips. Gluteal is the area of the gluteal muscles, so the buttocks. The perineal area is the area between the anus and the external genitalia. Popliteal is the back of the knee. Sural is the calf. Plantar is the sole of the foot. And calcaneal is the heel. All right, yes, you're going to have to know those. Again, you will see these in lab, so you'll become more familiar with them as you study in there and you learn these different regions associated with the models. Be sure when you're studying to use these terms, because the more times you reinforce them to yourself and to others, the more you're going to remember them. Directional terms are used when we want to describe one body part in relation to another. For instance, the head is superior to the pelvis. The hand is distal to the shoulder. So we're going to look at some of these terms, and then we'll look at some examples of how to properly use these. So distal means farther away from the point of attachment. So if you look at the upper arm or the upper limb, the arm, okay, the hand is farther from the point of attachment. So the hand is distal to the elbow. The hand is distal to the shoulder. Proximal is closer to the point of attachment. So the shoulder is proximal to the elbow. Now you can use these terms to describe one part of the body in relation to another. You wouldn't just say the hand is distal. That doesn't tell anyone that you're talking to the hand is distal to what. So you always need to define both terms. Same thing with superior and inferior. If something is inferior, it is below. If it is superior, it's at the top. It is above. So the shoulder is superior to the stomach. Okay? So we don't have to just look at these external features. We can talk about internal features as well. The small intestine is inferior to the liver, which means it's below. Okay? Medial refers to toward the middle, and lateral is to the side. So the sternum, I'm sorry, here we go again with this crazy computer. The sternum is medial to the arms. Okay? The clavicles are medial to the shoulder. They're more toward the midline. Okay? All right, so since we've got this up, I'll go ahead and look at some of these organs that you're going to need to be able to identify. Again, you're going to see all of this type of stuff in lab because it is a lot of what you'll cover in anatomy. But just so that you're familiar with some of these major structures, we have the esophagus, which is posterior to the trachea. So food goes down the esophagus, that is behind the windpipe, which is the trachea. There are the ribs, the right lung and the left lung, and the sternum. The upper arm bone is the humerus. The two lower arm bones are the radius and the ulna. The carpals are the wrist bones, metacarpals are the hand bones, and phalanges are the fingers. Here we have the liver and the gallbladder, the small intestine, the ascending colon, transverse colon, descending colon, and the stomach and the heart. All right, again, you're going to see these organs in lab, and we'll talk about them a bit more during that time as well. So some practice using directional terms. Remember, superior is toward the head or the upper part of a structure. So the heart is superior to the liver. The way that I would encourage you to study these, when you're looking at these terms, look at drawings of the human body. Find some good pictures so that as you're reading this terminology and you read the heart is superior to the liver, you can look at an image that shows the heart's location in relation to the liver. Inferior, the lower part of a structure or away from the head. The stomach is inferior or below the lungs, but we wouldn't use below because that's not a term used in correct anatomical position. Anterior refers to the front of the body or more near the front of the body. A term that's commonly used for anterior as well is called ventral. Ventral refers to toward the gut, okay? And posterior has another term. Posterior is toward the back. Dorsal is the alternate term for that. Dorsal means toward the back. Medial, toward the midline. Lateral, farther away from the midline or to the side of the midline. Intermediate means between. If we think back to the image we saw a while ago, we had the ascending colon on the right and the descending colon on the left. Well, the transverse colon was intermediate or between those two. Ipsilateral means on the same side of the body as another structure. So if you broke your right arm and your right leg, you would have ipsilateral fractures. Contra means against. So contralateral, opposite or against side. Okay, so the opposite side of the body. For instance, if you broke your right arm and your left leg, well, first you'd be in pretty bad shape, huh? You would have contralateral fractures. Okay, proximal is nearer to the point of attachment or the origination of the structure. Distal is farther away. Superficial is toward the outside or the surface of the body. So the skin is superficial to the muscles. Deep is internal. Okay, so farther away from the surface, the muscles are deep to the skin. Now there's a note down here about anterior and ventral and dorsal and posterior. In the human body, because we stand on two legs, anterior and ventral are interchangeable, as is posterior and dorsal. Okay, but in four-legged animals, dorsal refers to the back. Therefore, it is superior, okay, not behind. So posterior and dorsal, ventral and anterior don't mean the same thing in four-legged animals. All right, sometimes we want to talk about a particular view of a human body. So we look at planes and sections. Planes are imaginary flat line surfaces that divide the body into different areas. So a frontal plane is a section that divides the body into a front and a back. Okay, transverse divides into an upper and lower. Sagittal divides the body into a right and a left side, and oblique is at an angle. Now, you may be wondering, well, why is this important? I'm never going to cut a body into these different sections. Well, you may not, but you may use medical imagery such as x-rays and CAT scans and MRIs that are done on a sagittal plane so that you are viewing one particular body structure. Okay, so these terms are pretty well used throughout a lot of the imaging studies that you will see. And we'll see in just a minute when we look at some examples of a brain, how the same organ looks very different depending on the plane or section in which you view it. So practicing with planes and sections, we take a brain and divide it into a left and right. So mid-sagittal, remember sagittal divides into a left and right. Mid-sagittal is right down the middle. So if you do a mid-sagittal section on a brain and you look at it, here's what you see. So this is one side of a brain, okay? So here's the main part of the brain, the cerebrum and the cerebellum and the brain stem here, okay? So we're looking at a mid-sagittal section of the brain. If we take a brain and we cut it into a front and a back, here's the frontal section, okay? So this is still the same organ, right? But it looks very different because we are looking at a different section. We're looking at the front of the brain. So this is still the cerebrum, like we saw up here. We just can't see the brain stem or the cerebellum in this view. Okay? So if we were looking for a tumor that was embedded in the brain, in one of the lobes, deep in one of the lobes, it might be much easier for us to see or to visualize that using a scan that has a frontal section and perhaps a transverse section. Remember, transverse divides into a top and a bottom. So this is looking down on a transverse plane through the cerebrum as well. Alrighty, so let's talk just a little bit now about body cavities. Cavities are spaces within the body that separate, protect, and support internal organs. So we have several cavities that you're going to see in a lab. The cranial cavity is surrounded by the cranial bones. The vertebral cavity surrounded by the vertebrae. The thoracic cavity is the chest cavity. Within the chest cavity, we have smaller cavities, the pleural cavity that holds the lungs, pericardial, peri means around, cardi means heart, so the cavity around the heart, and the mediastinum is the area between the two pleural cavities that the pericardial cavity resides in. The abdominal cavity, okay, so the abdominal cavity is further divided into abdominal and pelvic. So this is the abdominopelvic cavity. I misspoke a while ago. The whole thing is abdominopelvic. The upper part is the abdominal and the lower part is the pelvic. Okay, so as you're looking at these cavities in a lab, be sure that you're paying attention to what organs are found in each of these cavities as well. These cavities in the human body are lined with serous membranes. Serous membranes are very thin, double-layered membranes that surround or cover the viscera. Viscera means organ. And surround and cover the cavities of the thorax, the thoracic area, and of the abdomen. Now, I mentioned that these are double-layered membranes. The visceral layer of a serous membrane is the layer of the membrane that lies directly on the organ. So visceral means organ, so visceral serous membrane covers the organ. The parietal serous membrane covers the cavity that organ is found in. these serous membranes are going to secrete a very slippery serous fluid that fills the cavity and prevents friction between the organs within that cavity and the walls of that cavity. So when we're looking at these membranes, the pericardium is going to be the serous membranes that cover the heart. So we have a parietal pericardium and a visceral pericardium. Remember, visceral covers the organ, so visceral pericardium lies on the surface of the heart. Parietal pericardium lines the cavity, and the pericardial cavity is the space between them that is filled with pericardial fluid. Same thing with our lungs. The serous membranes that cover the lungs are called pleura. So each side, the right pleural cavity and the left pleural cavity, have a parietal pleura that lines the cavity and a visceral pleura that lies on the surface of the organ. In this image, you can also see the area of the mediastinum. So between the lungs and the pericardial cavity is within the mediastinum. And you can also see the diaphragm. The diaphragm is a broad sheet-like muscle that separates the thoracic cavity from the abdominopelvic cavity. This gives you a transverse plane where you can see the lungs. Okay, so lung and lung. This is the left lung. This is the right lung. Here we've got the heart. You can see the area that surrounds them. So this would be the pleural cavity lined by those parietal and visceral pleural membranes. And same thing here with the heart. Alrighty. So within the abdominopelvic cavity, we call the serous membrane that lines the organs and lines the cavity the peritoneum. So the peritoneum, the visceral peritoneum, lines the abdominal organs. The parietal peritoneum lines the abdominal cavity. Some organs, such as the kidneys, are called retroperitoneal. What do you think of when you hear retro? Retro should make you think past or back. So retroperitoneal is behind or in the back of the peritoneum. So these organs, such as the kidneys, are not inside the peritoneum, but they are posterior to the peritoneum. Okay, so when we're studying the abdominopelvic area, it's useful to divide it into certain regions or quadrants. Most commonly, the 4-quadrant system is used, as you see here. So there is a right upper quadrant and a left upper quadrant, a right lower quadrant, and a left lower quadrant. Now remember, you are facing this person, so their right, okay, is going to be on your left. When you're doing things with correct anatomical position, if you're ever wondering about right or left, simply put yourself in the same position as what you're looking at, and then it makes it a little easier to understand. Sometimes you may hear of the 9 regions being used to describe organs in the body. Those are named according to where they're located. So right hypochondriac, chondri refers to cartilage. The ribs have a lot of cartilage associated with them. So under the cartilage, hypo, under, chondri, cartilage. So right hypochondriac, left hypochondriac region. Epigastric, epi means over or upon. So above the gastric, above the stomach. Umbilical, I bet you can figure that one out. Right lumbar and left lumbar. Left inguinal, right inguinal, and hypogastric below the stomach. Okay? All right, so for instance, if a patient comes in complaining of pain in the right lower quadrant, you read this on the chart, you're wondering, okay, well, I wonder what organs are in that area that could be causing the pain. Well, it could be the appendix, or it could simply be intestinal problems, right? If it's in a female, it could be the right ovary. Okay, if a patient has pain in the right upper quadrant, could be related to the gallbladder or the liver. Okay, so be aware of what organs fall in what quadrant. All right, so aging is a normal process that's characterized by a progressive decline in the body's ability to restore homeostasis. So cells and tissues are constantly dying in the human body, and we're replacing them. As we get older and older, the machinery within the body that takes care of maintaining homeostasis is not functioning as efficiently. We don't use nutrients as efficiently. We can't maintain blood pressure and homeostasis as efficiently as we once did. So as you continue your studies through A&P, you'll see a lot of mention at the end of several chapters about how that system or how that body organ is affected by the aging process. So things just slow down. We don't repair and maintain as effectively. All right, so from here, I'm simply going to rush through some slides because I wanted you to have access to see this because it's not in your textbook. This medical imaging is used to give physicians and clinicians a view inside the human body without having to use invasive procedures such as surgery to go in. So this allows physicians to diagnose things that just don't look or act, function as they should. And therefore, it can decrease those exploratory surgeries when you have to go in to find out what's wrong. Good medical imaging and technology that we have available today allows us to see inside the body quite well. So the following slides are going to have some details on specific imaging techniques that are not going to be included on your exam, but I did want to put this in there because it's very relevant to the clinical studies that you're going to be doing throughout your academic career. And if you're not going into medical professions, it's still going to be relevant because, yeah, you've got a human body. All right, so just a quick look at these. So each of these will begin with a description of the type of imaging. Radiography, or what we commonly call X-rays, is one of the more common ways that imaging is used. And here you have some examples of that. So you can see an X-ray of the chest. This is a mammogram, so an X-ray of the breast. Here's a bone density scan. This is a arteriogram or a urogram of the kidneys, not arteriogram, I'm sorry, a urogram of the kidneys showing a blockage in here. Here's an arteriogram of the heart, and here we can see a contrast X-ray showing cancer in the colon. Other types of imaging include MRI and CT scans. Okay, so these are used and then read on a video monitor so that you can see some of the softer tissues in the body and some of the fluids. A lot of these are done in transverse sections. Remember, we talked about that a while ago. Yeah, I told you it was relevant. All right, so some comments about each of these. Relatively safe, visualizes soft tissues. The MRI can't be used with metal, patients that have metal in their bodies because it uses a very, very powerful magnet in the imaging. And here you can see an example of each of these. There's an MRI of the head showing the soft tissues of the brain very, very well. And here you can see a transverse section through the thorax. So there's the heart and an internal view of the lungs as well. All right, so ultrasound is very commonly used during pregnancy to assess the growth of the baby, to make sure that the baby is moving around and doing what it should be doing and growing as it should. It can be shown on a video monitor and actually see some movements sometimes as well. Especially with some of the more advanced ultrasounds that are now available. And here you can see a pretty little face. We can't tell if it's a boy or girl though, right? All right, some cardiac or CCTA scans and PET scans. Again, some information about what they are and then some images. This CCTA scan of the coronary arteries is absolutely beautiful. You get a very well rendered 3D image of the heart. Here you've got some of the large vessels associated with the heart that we'll talk about, and here we've got some of the coronary arteries. And then the PET scan shows you brain activity. And I think this is our final one. The endoscopy is to insert a scope into a body organ or cavity and use a lighted instrument with a camera so that you can see into that particular organ. This is very common with colonoscopies and laparoscopy, where they're going into the abdominopelvic cavity, and also arthroscopy when they're going into joints. So this gives you a wonderful view inside the colon. All right, that's it, guys. I'll talk to you again soon.